division evaluation and where that is. And we have to make a decision, I think, as a board, as to what the next step should be. The next two items are things that I had wanted to talk about, that I'm thinking that we might move 7 and 8 down and do the COVID updates first, because they're the most important, particularly as things are evolving. And then you will get to maybe restructuring the public comment and the health director or health staff report. And then we'll wrap up with any next steps we have. So that's kind of the plan. So does anybody have any additional agenda items that we should make note of that wouldn't fit into one of these categories? No. Okay. I don't see any members of the public online. And so I think we can move on beyond the public comment section. And so in terms of review minutes, Jean, do you want to just preview that?
Sure. Did you want me to pull up the document, or?
Well, actually, maybe you know, this was for 2 meetings. One was the last one on November 5th, and one prior to that on October 15th. And since there were only 2 documents, and since they're fairly succinct, and I think overall well written, we thought that we would just send them out as we did a couple days ago to the board, have you have a chance to read them, and then you know, if folks have any revisions, comments, any adjustments, we could actually do it right now, and then move ahead to approve them with the amended versions. So let me just, I actually just have a couple things I just want to get clarification. So for the October 15th meeting, there was a note that there was an additional $50,000 in wages and $25,000 in expenses for the health division. I thought it was 20,000.
Yeah,
It is.
I think it is 20.
Okay.
20, 50 and 20.
Okay, so we should just correct that. And then the only other comment I had was at the end of that meeting, I think we did a motion to that the board supported the efforts to have 5 full members. And I didn't see that motion at the end under the other business piece. Am I remembering that correctly?
Oh,
I thought I saw, I'm trying to pull up, sorry, I'm trying to pull, I thought I just
I saw it too.
saw
I'm
that.
looking for.
Yeah.
Yeah.
Yeah, I thought I saw that in there as well.
Well, there's a there was a comment that says that Ms. Delias encouraged the board to vote in support of the recommendation for the charter change. And that a vote by the board might have more impact. And so it is mentioned in there, but it is not bolded as a motion where there was a roll call and approved. And I believe we did have a roll call and approved it.
Yes,
Oh,
that's
you're
true.
right.
That's right.
You're right. Okay, yeah, because I remember we did that.
Yep.
Good catch. I saw the mention of it and
Yeah,
then the
very
vote,
good
but the vote wasn't, but yeah, yes, thank you. All
Rick,
right.
you're muted, Rick. Unmute yourself.
Can hear you, Rick.
Hit the
There you are.
so can Jackie go back and just re-review the recording and insert the motion and the roll call so it's accurately noted?
Yep.
Okay, so those are my only two. Did anyone else, Carrie, did you have any
I
adjustments?
did. I had two small things. And they're actually, it's in the incident command updates, so it's a little confusing, but, so it's, there's a reference and it says Ms. Donnell volunteered to contact the MIAA. That was actually, contact the state. I was gonna put it in as a question to, on the local public health call. So if we could just change that to, DPH. And then there was, again, it's in the, command report, but there was a mention, it said, Ms. Donnell said something about, travel being unclear. And what that was that the travel policies were making people unclear about quarantine. It's not that travel wasn't unclear. Sorry, I have it up. So, but those, and then, yes, those are my only changes.
Okay. So Jean, you noted those two.
Mhm.
Thanks.
Any other comments on the minutes? No. Okay.
No,
Okay, can I have a motion to approve the minutes from October 15th and November 5th with the amendments as discussed?
Motion to approve the minutes from October 15th and November 5th with noted changes.
second,
Second. Roll call. Carrie?
Yes.
Paula?
yes.
Rick, yes. Okay,
We're caught up.
we're caught up. That's it.
Yay!
We only have to do one each.
Woo-hoo!
Great. It's fantastic.
Yes.
All right, so Bob, you're on.
Hey, thanks. Let me share my screen and a couple of times, see if that's helpful. Here's something that Peter was kind enough to forward to the board today. I'm going to start off by reviewing this document, the modified sign-in sheet. Then Joe and Kevin Kabuzzi, the director and the assistant director of the facilities department, are here. We took some Joe took some photographs of town hall to help you sort of visually see some things, and he'll address some of the questions that were raised. And then I'll come back at the end and try to hit some of these quickly. Let me just start by looking at the screening form. So I don't remember honestly who suggested what, but there were some good suggestions that for contact tracing, we should get more than just a name of who came in. So I've added address and best phone number. There was a suggestion to change the fever to a slightly smaller number, 100, and then to add a couple symptoms, cough and extreme fatigue. So those are the only comments the board made on the form. And, certainly they're fine with me. And I'd suggest, as I sort of did in an email, these documents will not live in eternity. Things will change. The board should certainly feel free to invite me in, at any time to change anything we're doing. So if the board have any other comments on the health screening form.
No,
And let me address the greeter part since it's related. There's two ways to open town hall that I can think of that our peers have tried different ways. The way I'm requesting is to do it on an appointment basis, a very limited basis. The other way is not to have appointments and to have it open, even if it's for less hours. If it was just open generally, you'd need a person sitting at a door to allow the public in. Where we're going to approach it from a different way and have appointments, the greeter per se will be a staff person or related staff person of who the appointment is for. So let's say someone has an appointment to see the town clerk. One of the town clerk's staff or the town clerk will come to the door, have the person sign this form, look at it, and off they go. And we'll come back to this. And then later they would escort them right back out the building. So there will be no wandering around. We'll figure out there's, I think, 6 or 7 counters in the building. We'll make sure all the staff is trained on these forms and what to do. And there's, several department heads in the building, almost always someone at a time. So if there's any issue with a person wanting to come in, but they shouldn't be coming in. You know, there's going to be immediate help for that person. I should also add that I don't really know what the demand will be to come in the building, but I can tell you right now, it's very, very low. I think I've mentioned last meeting, there's only 2 uses that I'm aware of. One is starting in maybe late December, January, the Board of Assessors or the assessors. And then right now, the town clerk for marriage intentions. That's something that has to be done in person. And as Laura emailed me last night, it's getting chilly out there. What can I do? And I think she said the numbers were 2 to 3 a week, sometimes less, rarely more. And again, like all the rest of town staff, we've been dealing with people outside, often in the courtyard, which is behind our building. We have picnic tables and chairs, so it's been fine. So those are the 2 areas that will be new and must have people come in the door, I guess I'll say. And then what's a little less known that Jean could speak to as needed is the inspections, building inspection staff has been super busy right from March. You know, all you got to do is look around and see all the construction going on, whether it's a big job in a house or commercial, or whether it's just a small, adding an office to someone's house. They're very busy, and they've been able to handle it outside the office. We are sure that in the winter, when it normally slows down, there will be people who want to come in and talk to the building department especially. So that's probably going to be the busiest area. And as Joe takes you on a tour of the building of some of the things that we've done, we could talk a little more about, how to control the appointments, how to control the flow, because typically contractors want to come in. Sometimes we open as early as 6:45 informally in the summer, but let's say 7 o'clock, and usually they're all done by 8:30, and they're then out on the job. So they come in and do the paperwork early. So I'm not quite sure how to balance what the demand might be by the hours. But we clearly cannot have more than one in the building at a time. And you'll see from the counter space why.
Yeah, if I could just jump in, the building division is physically located directly where I sit. I'm sort of in the back, so I have been physically very involved, and then of course, since the building comes under me too, that I'm also managerially very involved, and they have been, as Bob says, enormously, tremendously, crazily busy. And we have also, in the midst of the pandemic, despite my pleadings not to, switched over to an entirely new online permitting process, including payment of permits. And at the same time, we lost our building commissioner who resigned midsummer. So by all rights, we should be in a pretty tough spot. But because that woman in the photo, Kim Saunders, who is a rock star, can make the world work despite all the strikes that I just listed, she figures out how to come up with a winner, and we've got a good bench of building inspectors and a retired building commissioner that have been stepping up big time. And with Kim as the glue, it's all held together very nicely. And we have been serving the public in very interesting ways when they do need to have access, including Kim running to the door and grabbing checks from contractors and all kinds of crazy stuff. So I think what will happen is once they are now allowed by appointment only, I think that it will be some foot traffic, but my sense is that the busiest times for building are the spring and the fall, and this year is even busier. And we had a busy summer, but typically due to the winter, holidays, we should be seeing some leveling off. And as I say, the way that it's been managed has worked well. And if they're allowed to have as needed appointments, I think that will work well also.
Yeah, in a typically busy day at this counter on the outside, there could easily be 3 contractors at the same time being helped by various people. But this is an example of, one's gonna be the maximum. So I just wanted to share you with that as one example. Just to keep moving along, I think I'll now turn it over to Joe and Kevin. Let me just come back to one of the documents. These are some of the questions board members asked to talk about the building ventilation system, safety barriers. You just saw an example, if you can see it in the picture, between staff and general public, and then cleaning protocols for different areas that the public especially would be interested in and may use. So at that, I'll turn it over to Joe, and we have some photographs to use as needed.
Okay, so you want to go to the photographs first, Bob? We can just walk through the town hall?
Yeah, tell me where to start. Upstairs, downstairs?
So, yeah, you can start with the first one we saw there for inspectional services.
Okay. Technical difficulties. There we go.
So, thank you for having me tonight. Early in the pandemic, we as a group, department heads and the town manager met, to talk about ways to protect staff and the public coming into the town buildings. So early on, we purchased Lexan glass, quite a large amount before the demand really grew. And with that, we started to go around and look at key areas and we're talking about town hall tonight, in the town hall where you have all these windows that people greet the public, and to try to figure out a way that we could, set up something that was aesthetically pleasing, but also protect people from, when they're doing the one-on-one service. So what you're seeing right here is the inspectional services division, the building department, where we install all that Lexan all the way around, including the handicap accessible window down below there. And I will say that this was done under Kevin's direction with our maintenance guys. We did this in-house. We did not pay we paid for materials only. And we did this, this was quite a project because we did all the town buildings and all the school buildings and finished up early September. So that's the first picture you're looking at right there. You can switch it forward, Bob, please.
I'll go to community services.
Yep. That's in community services. That's a desk as you walk right in. That's a cubicle. The next slide will show you the large cube farm, we call it, where everybody sits in there. Everybody's desk, there's a barrier between them all, which runs about, I think it's 6 feet 6 inches. Thank you, Kevin. Up all the, attached to the existing the cubicles there. You can switch it, Bob. This is the DPW administration offices at Town Hall in the basement. That's an area right there where they deal with a lot of contractors coming in, and there's passing of plans going back and forth. So we completed that down there. That's the town clerk's window. Again, just a typical window in Town Hall. You got that one, the assessors and the collectors windows that we did the same treatment to. Yeah.
So I think that's all I have for pictures, Joe.
Okay, if you want to go back to that slide that showed the picture of the floor markings. Now, Gene Delios and I have been talking about, because we knew this was coming, the town hall was going to reopen. What you're looking at right there is we had these floor markers made up. They're vinyl, they'll stick to carpet, they'll stick to vinyl flooring. And we had several hundred of these made up that we're using in the schools that we're going to be putting in town hall. And that's the next thing Gene and I need to do, is to figure out, once we figure out the traffic pattern inside town hall is gonna look like, we're gonna do that. We're gonna put those in, as well as any signage that will need it, that will be up at eye level for people also. So I just wanted that to be brought to your
Yeah,
attention.
and I would say this part of the project is really when the general public is just wandering all over the building. When we're just taking people to appointments, we really don't need this.
Okay,
Depends on when, the general public is just allowed in, we'll clearly need that. And the other thing Joe just mentioned that we didn't bother showing pictures is there's already signs all over the building, outside the building, near doors, near elevators, just giving reminders of different safety protocols.
correct.
One that I do imagine being a little bit tricky is there's a sign saying, I don't know, COVID-19, one person per elevator. Some of our patrons who are disabled or elderly often come with a second person. So I'm sure there will be occasions when there really has to be two people in the elevator, but it's just a reminder all over the building to use safety protocols.
Yep. So the next item I think I saw on the agenda was to talk about the building ventilation system at Town Hall. If anybody's heard us talking at other meetings about the preventive maintenance program that we have in the town of Reading, we have a preventive maintenance program that we perform on all of our mechanical equipment religiously across all town and school buildings, including Town Hall, of course. We have optimized the amount of outside air that we're bringing into all the buildings. We're bringing more fresh air than, but we also have, there's a fine line right there, because you don't want to freeze a building up in the winter. But we want to make sure that we're bringing as much fresh air into the building as possible. We've increased the number of filter changes that we are doing in all buildings, including Town Hall. We have ordered MERV 13 filters for the town buildings, including Town Hall, which we're waiting on, and those will be installed over there at the Town Hall. And we also, which also relates to, I guess it doesn't relate so much to building ventilation, but just good cleaning, and we're using HEPA filtration vacuums wherever possible, because that's one of the suggestions from the CDC also. Okay. So that's really what we're doing as far as maintenance, preventive maintenance on the mechanical equipment in the buildings. And we've increased those items and upgraded wherever possible. Anybody have any questions about that? Anything? So the next thing is, which is the cleaning. The town hall is, we have a staff of 4 custodians on the town side, and we have a full-time person that is in the town hall cleaning, and then at night we utilize an outside cleaning company to do everything except behind locked doors, which is common areas. All right, just want to be clear on that. What we've done is we are using a chemical to clean, doing the spray and wipe method. So it's a CDC recommendation that you clean before you disinfect to remove as many germs off of surfaces as possible. And then we use what's called the spray and wipe method on the surfaces at night, okay, in the buildings. And then during the day, because because of COVID, we've repurposed our custodians, I'll say, to have more of a presence in the buildings. And when I say that, the guys are going around constantly in the town hall, disinfecting high touch areas, doorknobs, light switches, bathrooms, getting into the bathrooms on a higher frequency. Tomorrow, as a matter of fact, we've actually purchased what's called misting machines. You guys have probably heard the technology used. Everybody's been, it's a big thing out there. We're employing these misting machines on the school side right now. We've purchased 4 machines. One of them is going to be at Town Hall. And the purpose of that, and we're going to get the guys, Kevin's having the guys trained tomorrow, I believe at 11 o'clock. And we're going to and these are all These are all chemicals that are EPA registered. They have an EPA number. They're known to kill the coronavirus, that have a 1-minute dwell time. So, and there's no wiping required when you're done. So once the area is cleaned, we can use the machine, spray an area, and it flashes very quick. They call it a flash. It flashes and dries, and you don't have to wipe it. So in terms of being able to get in and out of areas quickly to clean, we're going to pick up time for that. We also have a policy, I won't call it a policy, but a process that we have in the event of an emergency. If someone has COVID symptoms, we'll call it. We've done it before. We've done it at the fire stations. We've done it at and at the town hall, where we've dispatched the cleaning contractor we use to come in, and they go through and they clean and they disinfect. And the advantage of having them available to us is that if we have an area that we knew someone was in, suspected, we can get in there, close the area down, clean it, disinfect it, and then reopen the area. Okay, so that's a very, very, that's a good place to be, to have that ability to be able to come in and go back out again and get the town, the buildings back up and running.
Joe, can you talk about what the turnaround time is, estimate?
The turnaround time, normally, it's usually like 30 minutes. You can get back into a space. We don't want to be using, if we're using the spray and wipe method, you can basically go in there. It takes longer to do an area. If you're using the misting machine, they say about 30 minutes, it's okay to go back into a space. We don't want anybody in an office while we're doing the misting. Okay, it's very important to remember that. All the guys are wearing the PPE when they're doing it. Obviously, they're outfitted. Kevin makes sure that all his guys are fully outfitted and fully trained, even to do the spray and wipe method. So,
yeah, and I can talk about the one example at Town Hall. I don't remember the exact time of day, but it was near the end of the day when one of the employees suddenly learned they had been exposed potentially to someone who had just tested positive. So, one of the advantages of not having the public is we were able to close the building in 10 or 15 minutes and send everyone home. It's near the end of the day. I stuck around for Joe and the cleaning crew, and it was less than 20 minutes from the first thing we heard to when the cleaning crew was here. So it was really fantastic. And again, we could have come back in the building, but at that point, at the end of the day, it just wasn't worth it. So, we didn't come back in. If the public were in the building, for a limited appointment basis, I'm not concerned. If we had appointments outstanding, we just call people and tell them, I'm sorry, we have to reschedule. If and when I come to see you about the general public, that's a different discussion. There's no point in having that tonight. But facilities has been great. In addition to building a lot of things and doing a lot of work themselves very cost effectively, the employees in all town buildings, and I'm sure in school buildings, feel very safe. And that's really important.
So, I think that's from a facilities point of view, I think you've done a great job in covering all the bases and responding to the questions we had, but it sounds like you already had those things under wraps even before we commented. Any board member have any questions for Joe or Kevin or anything? No?
Yes, thank you. Yeah, you're
Yeah,
very
thanks.
thorough and very, very thorough, very complete, meticulous. It's great.
Yeah.
Great work. Thank you for that.
Thank you.
Did a great job. Keep doing it.
Thank you.
Thank you for your hard work.
all right, thank
That's
you
great.
very much.
Thanks, Joe and Kevin.
Welcome.
Thank you.
Stay well, guys.
All right, thank you.
Thank you.
Just to come back to sort of finish up, I talked a little about the greeter. Again, with appointments, I think it's a relatively simple and straightforward process. There'll be probably 4 or 5 people in the building that need to be trained on the sign-in sheet, but it's not complicated. Joe talked a little about the signage, and again, that's a little less important without the general public walking around, but could become important when we change that. Mask usage by staff and the general public, the board does have the right to require mask use by the general public for the building. The only time the board could not do that, as I understand it, was election related. So at the polls, you couldn't require it, but for a building, you could, and I certainly would suggest you do. Staff, when dealing with the public, will obviously be masked up. And then we get into the gray area where we've had a lot of discussion with the state about, what are the rules? And 2 weeks ago, the lieutenant governor said, she gave some examples. She said, use the office protocol. That's the rules. And then gave an example. If a town clerk is sitting in her office, she doesn't need a mask on. If someone comes to see her at the counter, they both need to wear masks. So that was at least the example. I think we're going to be a little more cautious in that, and certainly we'll do what you say. But the best example I can give is in my office. Caitlin and Jackie sit outside. They have 2 desks. I sit in an office with a door that could close, but is usually open. I think I reviewed last meeting sort of the space size, and it should be 2 of us in those spaces, not 3. For about 2 hours this afternoon, for the first time in a long time, all 3 of us were here. Our rules with each other are, if just one of us is in the space and there's no one else anywhere, no mask is necessary. If there's 2 or more of us, we wear masks. But I have to say that if I'm sitting in my office as I am right now and I close the door, to be on meetings, I'm not using a mask. And whether that's good, bad, or indifferent, I have one ready at all times. So if someone were suddenly to knock on my door and come in, I can do this, and I do that. And looking around the building, again, there are combinations of offices like mine with doors that close, spaces where there's only one employee, and then there's spaces where there's more than one. So our rule of thumb has been, first of all, try to work different hours, stagger your schedule, try to work a little bit of remote as possible. And then secondly, when anyone is within 6 feet or 10 feet or 15 feet of each other, just wear a mask. And we're doing that. But for employees that are sitting alone in an office, my guess is I occasionally forget and I leave mine on. Normally, I'm not wearing one, and I'm guessing normally the rest of the staff. Like if Gina's in her office with her door closed, I'm guessing she's not wearing one either. So, feel free to comment on that. The staff lunchroom is still closed, and I don't see us reopening it anytime soon. I don't want to encourage employees to gather. It's kind of mean, but it is what it is. We haven't really developed a meeting room policy, other than we just generally don't use them. Laura Gem used them for elections prep and both for the September and November elections, but used safe distances and good protocols. The meeting rooms are used both by volunteer boards and committees at night and by staff during the day. I can't remember going into a meeting room during the day more than 1 or 2 times since the summer. There's several of us in the building. When we have a meeting, we're all in our office with the door closed using Zoom. It's just safer. I remember one time when Zoom wasn't acting well, and I realized I was talking to 3 people 1 floor below me. I went downstairs and we kept our distances and just talked. But our general philosophy is not to use meeting rooms. And I shared with Mark Doxer, the select board recently, an example of, should they want to come back into the building and start meeting again in person, they could certainly do that with the Board of Health's permission. But as a practical matter, the room they meet in is, CDC guidelines suggest a maximum of 8. So that would be 5 board members, presumably Caitlin and myself, and 1 member of the public. So that's not really a public meeting. So I have not heard the board ask to come back in the building, and I don't know that it's terribly practical, at least not for the general public to be involved, unless we found a much bigger space. And we could do that. We could, secure a space in a school for night meetings as necessary, because public hearings are harder to do with remote technology. But so far, I think the technology is doing well. I think, we've been through 2 town meetings now, and I think generally it went pretty well. From a technology standpoint, it was not the same as being in person. It was hard to just go talk to the moderator and town council when it's remote. But again, I don't think meeting rooms are an immediate issue until, again, the general public, including volunteers, might be welcome back to the building. I've thought about it, and I talked to different staff members about, are there better days or better hours for us to be open for appointments? And there really are, but I think we should just stick to the 7 o'clock in the morning till 5:30 at night, or maybe 5 at night, late night on Tuesday as needed, and just use the appointment process. If it's convenient for the public to come in at 4 o'clock on Monday or 10 o'clock on Tuesday, it really doesn't matter to staff as long as we're doing the right thing from a protocol standpoint. So I know there are some towns who are limiting the hours that the public can come in, even by appointment. I don't really think that's necessary because, again, I don't think our demand will be high. But this is one of those things I could go back to you, after we have some experience and say, it's just too busy. We need to somehow regulate it a little better because everybody wants an appointment. So we'll sort of see with that. In terms of the form itself, I assume the public health nurse was the proper communication vehicle so that, we'll collect the forms. If there's anything on any of the forms, that are indicating a problem, we'd give it to her. We can give it to her on a regular basis for contact tracing later purposes as needed, whatever protocol you want to put in place. But we just assumed that was right. But again, we're not seeing a lot of health division staff sitting around in the building. Again, they're out, they're doing things, and they're working remotely, as some of us are. And then the last point, which I don't know how important it is, but I think it'll become important, is as the building is more used, and maybe this is not so much for the appointment stage, but the general stage, I have to accept feedback from all building users, I think. I want the public to feel comfortable in this building. If they see anything that concerns them, I want to know that. Likewise, if employees see anything, I want to know that. We're kind of doing that now already informally. So it's really more adding the public to the building that makes it different. But I would think that the Board of Health, would also want some sort of feedback loop about what's working, what's not working. And as all of you know, the rules change so quickly. I guess there was a governor's press conference this week where he made a change that he didn't tell Mass DPH about in advance. So these things happen. Everyone's doing the best they can, working on the fly. And I think the most important thing that I can do is to just be extremely flexible and deal with things in a practical way. So at this point, if there's anything that the board has heard or not heard that's concerning, I'd certainly welcome it. As I mentioned in one of the emails, if the board wants me to add to some written protocols, that's easy to do. I struggled with it for the last week, and so it wasn't easy to do. I really thought you'd get much more out of a discussion with Joe and I for tonight. But then if we want to write up some things in addition to the sign-in sheet, we're happy to do that. I talked to Amy quite a bit from the library. They have people who are happy to come to the library for different reasons that people come to town hall. So, people have wanted to go to the library, and I'm married to one of them, pretty much since it closed. Again, that's not the demand we're seeing on town hall. It's the folks who really have to do it because there's no alternative, and they don't necessarily want to do it, but they have to. So whether it's marriage intentions, abatement applications, or whatever, they have to do it. Our assessor was a little concerned this summer, and we sort of tested it out for the senior tax relief applications, which have always been in person for the last few years we've done it. And in most cases, I want to say 95% of the cases, it worked out fine. Sometimes he did go out in the parking lot, they all masked up, they chatted with a person, had a discussion, and it was fine. And I only remember one applicant who decided not to complete the application or the process, who complained that he wished town hall was open. But he agreed that he did get reasonably good customer service in the parking lot. It's just that's not what he was accustomed to. So, I think we did the best we could. I guess in conclusion, Obviously, we welcome your feedback at any time. That should go without saying. But it would be beneficial. Technically, the board had previously voted to close the building to the public. And it would be helpful if that could be reversed in some way as soon as you're comfortable. Whether to give the authority to Peter or to me, I don't know. But again, for the marriage intentions, that's really something we'd like to have sooner than later. I don't think it's a hurry on the rest. But if someone wants to come in next week and get married, they have to see the town clerk. And if it's 35 degrees outside, I don't want the town clerk to need to take them on a drive or in a car around town to stay warm. I want to keep people at a safe distance. And in discussion with employees in the building, I think generally people feel pretty safe. And I would think, although no one said this, but I have to think they are concerned when it's not the colleagues they know coming in the building. And it could be anyone who may or may not believe in masks, may or may not have been social distancing, and it just does open a different risk element to all of us. So, Rick, if you want to start off comments, I'm happy to go.
Sure. I mean, I think between, at least from my perspective, between the document you provided at the last meeting that we reviewed subsequently and, your response to the feedback and the comments, it seems like you've covered the scope of everything that needs to be done, that can be done safely in terms of opening town hall. I reviewed the CDC, or actually the mass.gov office guidelines as well, and applied them to what you're doing. And it seems like you've checked, all the boxes. I personally don't feel like we need to write up a tome of protocols and detail. I think we have this meeting as a recorded document of what you're planning to do, and we have the documents you provided already. So if we have to go back and there was some question, that I wouldn't feel like there needed to be reams of written protocols. The board members may feel differently, and we should talk about it. So at this point, I would be comfortable about taking a motion, but I want to hear from the other board members how they're feeling about this going forward. Kevin, since you're in the center of my screen, I'll just call on you.
No, I couldn't agree with you more. I think they've done a phenomenal job with setting this up. I think it's a real, sounds like a very safe environment. I think, the public should feel as such with all the precautions that have been put in place. So I would agree with you, Rick. I think, opening up right now, it'd probably be helpful if whoever made the motion, Bob, if we made the motion by appointment only. You could always then throw it back on us. Sorry, go talk to the Board of Health. They set it up this way.
Yeah. I would add, and I didn't mention this, but our intention, or at least mine, is to keep the doors locked. I don't want people just wandering in without an appointment. Staff has ways to get in. The public should not, sadly, at this point. I'm imagining that in the best of circumstances, maybe in mid-January, we sit down again and we say, things have finally improved after the holidays. Let's open up the building a little more. But honestly, I don't see it before then.
Paula, did you have a comment?
I didn't. I thought that this was a great review, and I think you've, as far as I can see, checked off all the boxes. Good work.
Jerry, any thoughts on this? Or?
I agree with everything that was said. This is a great job. I think the only thing that I would ask maybe for a little bit more process around is how the contact tracing is going to work, like how the forms are going to get to the health department, and whether or not the individuals entering the building are going to be told who to contact if they get notified outside of this. So, but other than that, I think this is a great plan.
Okay. Carrie? You're on mute.
Sorry
You're
about
muted.
that. Nope, I'm fixed now. Thank you. sorry about that. I agree with everything everyone said. Thank you, Bob, for taking the time and being so thorough. You know, it's like as well as your staff. I think you've covered all the bases. I agree with Jerry about the being clear about the contact tracing protocol, the storage of the sign-in, you know, the sign-in sheets and information sheets and the like, and how long, and that's important to be clear on. And I think the only thing you talked a little bit about masking, Bob, which is separate from opening the building. I have no issues with opening the building. You talked about, you know, being interested in some feedback from us about masking protocols and whether there would be a requirement to be masked in the building. Yeah, I would support that. You know, I mean, I think that there are ways to craft that and saying, you know, if you're not alone in a space, you should be, you know, being masked, especially as we see the cases going up. So I support that, and I appreciate the efforts sounds like everybody's going to keep everyone safe.
Thank you. And, you know, in addition, if you're to make a motion tonight, I would ask that you require the general public to wear a mask. Now, we all know there are exceptions to that, and if they want to go down that route, obviously we'll go down it with them. But it does have more power if you make that statement. Mm-hmm. As we know, not everyone wants to wear a mask. I have to say, Reading's pretty good, though, from what we've learned and been through. Amy said at the library they have not run into any instance of someone refusing to wear a mask and wanting to come in, which is terrific.
That is great.
And I would leave it up to Peter and Christine to follow up on Jerry's comment about how that process is going to work, about those screening forms and so forth in terms of contact tracing.
Thank you. Will.
So can I have a motion to, I guess, to reopen by appointment the town hall based on current plans to provide for public safety?
I'm happy to make that motion that we reopen the town hall on an appointment basis only, and that the public is required to wear masks when entering the building.
Okay. Roll call, Carrie? Yes. Paula?
Yes.
Rick, yes.
Hey, thank you. I greatly appreciate it. I'm sure we're going to need this soon. So thanks.
And I think it's a great idea, you know, I'm sure we'll be in touch, but, you know, to come back to the board in January or something to, you know, let us know how it worked out. And, you know, we need to do anything.
You know, I think we're all going to learn.
Yes.
You know, once we allow the public in by appointment, we may find out there's much more demand than we thought there was.
Yeah.
People just, you know, came up, saw the sign and went away.
Bob, have you heard of any problems with the library with their protocols?
No, I haven't. And the one area I did not ask about is what their protocol, you know, from an emergency management standpoint, that, you know, you can't always be 100% prepared for everything because it's not cost effective, but you got to be 98, you know, or something pretty high. As Jean knows, we had a public health nurse, I want to say 32 and a half hours a week several years ago, and that person was bored out of their mind. They had nothing to do. So over the years, again, with, you know, consulting with the different boards of health, we reduced those hours. And I want to say at one point, 8 or 10 hours a week was deemed to be sufficient. Now, I don't think it is anymore and won't be for some time. You know, but the history is sort of not, you know, management driven, I guess I'll say. It's been board driven all along. And one thing you'll hear in the community, unfortunately, is that there's not good public health funding in Reading or anywhere else. I will tell you that pre-pandemic and pre-Peter, the budget for health is as high as it's been since I've been town manager. So it has not been cut. It had been cut several years ago before me, but it has been increased since then. And, you know, I'll do what I can. I can't necessarily promise everything you get right away, but, you know, we'll have a discussion. Gene, again, will see the select board in December with the big wish list. And then we'll have to have a discussion between December and January of how to, cut that down to something we can afford. And with your help, we'll prioritize what you want to add in over some, 2-year, 3-year period. I think the part I'm least familiar with, and it would be helpful for you to flesh out more, is the community health aspect. If there weren't COVID, what kind of things would a health division want to do in the community? I've sat through some meetings with some discussions about that. But again, different boards have had slightly different views of that. I'm sure you've heard of, the pesticide, pre-lawn pesticide discussion, for instance. I know Kevin sat through that. So there's been different aspects. And then, healthy Reading, how can you get people to eat healthier? I don't do a lot of eating healthy, so that's not my specialty. But that's the area where I am weakest and would benefit from the most, but I know it's also not my focus right now. But in terms of longer term planning, I think that'd be real helpful. And maybe that more comes out with, some outside professional RFP type help you get at some point. But it's really very comfortable for me to be hearing the way you're discussing about staffing. I get it.
We have talked about at some point early next year about doing a community needs assessment, which would have to be which would be a process that would result in identifying whether it's healthy eating, whether it's, dealing with depression, hypertension. There's a lot of mental illness. I think Peter had mentioned it at one of the last meetings. There's a lot of other areas that are beyond just routine food inspection and so forth, or dealing with COVID, that we could be doing, and that would be the hope. And hopefully, it would come out of a community needs assessment, and then we would develop a plan to address it.
Yeah, and it would be really great if your board could become a little more aware of the resources with the former Arcasa, because this topic is discussed. I was just at a board meeting last night, or whatever we're called now, and mental health is front and center. Mm-hmm. So, we have 2 full-time staff working in peripheral areas, and again, to Gene's point, just because you can't see them in your budget, doesn't mean they're not there.
Yep.
So we're happy to have them come in and join you at a meeting sometime, for instance.
Actually, that would be good, because I would like to know exactly what they're doing, what they're focusing on.
Actually, Bob, I'm glad you brought that up. Just to jump in real quick on that. What we used to actually do as a board, we had one of our board members go to the meetings and represent the Board of Health there. Could then come back and report back to the full Board of Health as to what they're doing, what plans they have upcoming and what have you. So, that'd probably be a good idea. I think obviously once COVID hit, we had enough of our own meetings to go to, let alone go to other meetings. So that kind of fell by the wayside, but it's probably a good idea to have one of our members, and it could be the same thing like the command. It could be a rotating thing. It could be one individual, but it's probably a good idea to start going to those meetings again. You're absolutely right, Rick. I mean, the mental health component that's going to be coming up over the next year or 2 or 3, and that's already before us right now. I think is going to be something that this board's definitely going to want to take some interest in.
So one of the things that we could also be looking at, and this might just be something that we haven't talked about before, the previous boards hadn't talked about before, but every nonprofit hospital has to do community health needs assessments as well. So research has shown it's beneficial when the hospitals work with the local departments of public health and they jointly look for programs, because hospitals may have some funding that could meet our needs. So it could be a partnership opportunity.
Yep.
That's good.
Determination and need.
Absolutely.
Great.
If I may, I'm fully in support of the need for a full-time health director. I'm relieved to hear the conclusion when Dean was talking about the available resources of nursing throughout the community, that the conclusion was still that there is a need for additional part-time nursing hours. I think that that's very important. I think, a 10 to 12 hour a week is fairly low. And yes, there are lots of resources, and the town's done a fabulous job of working together and augmenting those, but I don't think that's a permanent solution. And that would be why I would advocate strongly for additional nursing hours. I would also say when we talk about the professional development, that's going to become increasingly important for public health. I'm a little bit of a broken record, but there is legislation pending about workforce required credentials for all members of the public health workforce. A lot of the credentials will be based on free and available training, and there should be some funding available from the state to support the training of the workforce. But this is going to be something that folks are going to be continuing to look for. They're going to be, as Peter knows, looking for, they need training, they need contact hours to be able to continue their licensure. They need to be able to access those trainings. And sometimes it's not just about budget, it's about making sure you're adequately staffed so people can actually step away from the job and take the time to do the 2-hour training or the half-day training or whatever it is. I lived that. I know, lots of people live that. It's hard. So that's an important consideration. And then I'll just say, with the community health piece, I think I'm thrilled to hear that you want to talk about that. And that will have to come from a thorough assessment of the community so we know what the needs are. We could all kind of speculate and what it's the allegory of the elephant. The 3 blind men are holding onto the trunk in the middle and the tail, and they each know exactly what the elephant looks like, but they only have a piece of it. So we really need that community assessment to help guide us, give us some data, and show where there ought to be some work, some resources dedicated. And Erica at the coalition is a MPH, is a great resource. So wonderful if we collaborate with them. That's all good.
Great. Any other comments or
If I could just add one more comment. So luckily and thankfully, Christine has jumped in and provided more hours to the town than what has been what we hired her for, which she was hired right before this pandemic. So I just want to say thank you to Christine, because I think the budget is 12 hours a week, and I think she's on average working double that amount. And that's just tremendously helpful and beneficial. But B, I also want to thank Bob for having the foresight to add more dollars into the budget to absorb that, so we don't have to give any thought to extra hours for Christine, and the budget is there.
Absolutely. Thank you, Christine, for jumping into the breach as well.
You're welcome.
I don't know how you do it with another full-time job or another job.
Really?
So, I think perhaps what we could do is our next meeting is, let's see, December 3rd. And so maybe we could ask Jean and Peter to come back at that meeting with maybe a formal recommendation of what they're proposing the budget should look like for 2022, based on this discussion. And, it'd be useful to see, and Jean, you shared it with me at our meeting earlier this week, it'd be useful to see the current budget, the proposed budget, and what the change is year over year. All right.
If I could just add one more thing. So yep. As Bob mentioned, the select board presentation is when department heads go before the select board with kind of the wish list budget. Board members are more than welcome to attend. So we haven't got the schedule lined up yet, but I think if the Board of Health is meeting December 3rd, then the following week, we have a regular select board meeting on the 8th, the following Tuesday, and then the Wednesday, the 9th, the Tuesday, the 15th, and the Wednesday, the 16th are the budget dates that the select board has made available for department heads. I know the other boards meet, and I think Conservation has a meeting on the 16th. So we'll try and, Bob and I'll try and work it out. We try and schedule it so that it doesn't conflict with board meetings, but that's never perfect either.
Great.
And just so Kevin knows, the next time he needs to go to an RCASA meeting is also the 16th. I heard you volunteer. So 5:30 on
Not have
Wednesday,
opened
the
my mouth.
16th.
All right.
All right. So we're going to move on to this RFP discussion. And so let's see. Let me step back a bit and provide some context here. A few meetings ago, actually maybe 2 or 3 months ago, we decided that it would be useful to have an independent assessment of how the board and the health department have been working in order to understand what we might request for the 2022 budget process. As it turns out, as we just talked about, this assessment is not going to be really done in time, to have this formal independent assessment for the budget process. But we also, sort of the second reason to have this was to really to understand not only how we stand and where the gaps are and what could be made more efficient and where we needed more resources, but potentially even how we could raise the functioning of the health department to even potentially either meet statewide standards from that report that came out a year ago last summer in the state, or even national accreditation. So we sent out an RFP to 4 consultants. It was due back actually on November 5th at our last meeting. We got one report, one sort of proposal back from the Metropolitan Area Planning Council. And we had talked about spending no more than $10,000, and they tagged their proposal at $36,000. And as we talked about earlier at this meeting, we had $20,000 at most to spend on this. Allison did ask the other 3 why they didn't submit proposals. There wasn't any, from what I saw, there wasn't any sort of single dramatic reason. I think there was a sense that the scope of the request was broad, and some of the standards required for some of the consultants were too high that they couldn't meet. And of course, we know that consultants in this area in public health, there's not a whole lot of them out there. It's interesting, having come from a large healthcare system like Atrius and dealing with health plans and hospitals where there's a lot of money. There are tons of healthcare consultants out there. Public health, not so many, very few. So the subcommittee that the board designated, which was myself and Jean, Bob, and Allison, did meet along with Peter actually earlier this week on Monday to talk about, what might be the next steps. And so that's really the question before us tonight. What could be the next steps going forward in this effort? And I'm just going to throw out a bunch of options and kind of get your reactions to them as to what we might do. So there's about 4 or 5 here. So one thing we could do is we could basically put a pause on the idea of an RFP based on the fact that we now have Peter here, and he's begun to work with the staff to understand where some of the problems are and where some of the improvements need to be. And we could reassess things in January or February and say, you know, have we made enough change to feel comfortable that, and particularly if we get some of these resources we just talked about, to feel comfortable going forward without necessarily an independent analysis specifically around health division functioning. So one would be pause, reassess January, February. A second, you know, would be to do what we've actually already did, which is just propose some additional resources that we think we need going forward and see how that plays out in the budget process. A third possibility could be to take the same RFP proposal and just simply send it to a lot more consultants if we can find them. And I would probably lean on Peter and Jean and Kerry and anyone else who was in this kind of circle where there could be more people we could literally send the same one out. Another possibility would be to go back to the MAPC who submitted the proposal and negotiate down the price and go with them, which might require, you know, reducing the scope of the proposal. Actually, you know, Jean pointed out to me that the proposal has sort of two components to it. One is looking at our current health department, doing a comparative analysis, how it compares to other health departments in similar size, and, you know, what some of the standards are and where we might need improvements. And then there was this other piece around, you know, national accreditation, how do we match to, you know, higher levels of standards. We could split those two pieces, and, you know, if we were really more interested in the first rather than the second, at least in this first go around, we could just rescope the RFP and send it out with a sort of a smaller scope and see if there's more interest. So those are some of the ideas we came up with, and I'd be interested in hearing, you know, given what we're going to try to get through the budget process, and given Peter, who is sort of a new factor here compared to when we had started this conversation back in August, you know, what do people think?
My first thought is to pause. I mean, we're in the middle of a pandemic. We've done, the people have been crazy working on pandemic issues. And we've made some changes with bringing Peter on board, and which has been a benefit already. And let's see how far we go with that, at least for this year, and then revisit the whole idea in calmer times.
Okay, good. Other thoughts?
Yeah, I also would support a pause. I continue to be interested, in no disrespect to Peter and his experience at all, but I continue to be interested in an objective third-party assessment. I think that it's valuable to the town, it's valuable to the department and future boards. I think that that kind of thing has some value to it, so I would continue to be interested in it. Certainly interested in seeing how we could rescope. I'm a little disappointed to hear that it came in that high, and I'm a little disappointed that well, but I understand, because all of the consultants that it went to, I think they're public health folks that have been brought in to support other communities in the midst of the pandemic, and they're not available. So a pause to assess, but I still would like to see an assessment of some sort. I think that that it has value to us.
Agreed. I'm just saying pause for now.
Yep.
Other comments, Kevin or Jerry?
I agree with the pause too. I think, what Peter is bringing to our attention is very valuable. But hearing, how Jean described this RFP as having two scopes, it sounds as though, the first part of that RFP would be more challenging would be great for a consultant, but maybe the second part, which is outlining national accreditation standards, could be a great capstone project for a public health master's student.
Mhm.
It would be harder for them to get real world information on what's going on in any individual town, but certainly they could reach out to the national boards and get some more feedback. And that would, be free or potentially free.
Okay, Kevin?
Yeah, so obviously I think you have to take a pause, right? You just, it's pretty simple math. I agree with Carrie though. I think it's important to have a outside perspective looking in, right? It usually gives you better insight because we're all kind of in the middle of it. You miss things unintentionally, but you miss things because you're in the middle of it when someone from the outside can see them blatantly clear. And so I think you really want to get to that point. I'd be surprised. Well, no, I shouldn't say that. That doesn't surprise me anymore. If there isn't any kind of federal funding, grant funding that we might be able to get to offset some of our costs, I think it'd be important to maybe look into that avenue, even at the state level. The example of the money that we got to go specifically towards employee hours that are code related, right? So things along those lines. I'm sure, there's plenty of money floating around in the government, both state and federally. And right now, I'd assume that there's plenty flying around from a public health standpoint. So, I think if we could maybe look into that kind of avenue as well, while we're kind of moving through this winter that we're about to walk into, that would be good. But I think in the end, I agree with Carrie. It'd be great to have that full assessment done and be able to look at it.
Okay, good. Jane, can I ask you, can you pull up and share those two paragraphs from the RFP that you showed me on Monday? Just so people can see the difference between, the two requests.
I'm just gonna need a minute here to grab it.
I can update the board. I was on a call today with the state lieutenant governor and others. And the number one topic is how funds are going to disappear on December 30th and what are we going to do in January. So everyone knows we can't not have funds, but the state government has no idea whether the federal government will provide any. So, you should have seen a letter, and if you haven't, you will, that there is a possibility that the funding for boards of health will come through regardless of what happens. So the current request is for $15 million to be spread out, which isn't a lot, but it's similar to what you got in the past.
Is that document visible?
Yes.
Yes.
Okay. I'm working with a headset now, so I'm
Oh, good for you.
juggling. Yeah. My first night on a headset, so bear with me. I only have one port, so I'm not able to use a mouse. think this is where we were.
Right. So, so I think that, you know, if you read this, it appears that to achieve the goal, that sort of middle paragraph, you know, it would be review of programs, processes, information, you know, and this is really kind of looking at the current structure. And then the paragraph below that is kind of, you know, looking at blueprint for public health excellence and accreditation standards, which is, you know, important, but could be done separately. You know, perhaps as Jerry commented, you know, we could potentially have someone do that piece separately. So those are the, I just wanted to sort of, hopefully this makes it a little clearer what we were asking for.
Mhm.
We could split that out.
Yeah, and I think that the inclusion of the blueprint for excellence was because I, at least, you know, was talking about how we knew this was coming down the road. It would be important to kind of make sure that that was context. And then I think the FAB standards was kind of like a great stretch goal, you know, kind of to see. Yeah, I understand what Jean and you discussed about they're kind of two separate pieces.
Right.
Because you would be looking at the Mass General Law requirements for the assessment of standards of practice. So I understand what your observation is. Thank you for pointing that out.
So,
You know, if I might, I hadn't read the RFP in enough detail. In the past, I've issued RFPs and had various reasons why they failed. A subtle one is you put in a deadline that's probably pretty unrealistic.
I know.
You know, we'd like this report by year end, by March at the latest. And I can tell you, once I hired someone who was the only one that could compete or complete the work in the time frame, and everyone else told me it was unrealistic, and I regretted hiring them as soon as I did. So, you know, it could be that as simple as the time frame just kicked too many people out at this time of year during a pandemic.
Yep. Agreed.
good point, yeah. So I would say, based on this conversation, I think we'll put a pause for now. We'll definitely revisit this in January or February and kind of see where we are at that point and decide, you know, how we want to approach it. All right, I'm gonna, on the agenda, I'm gonna skip 7 and 8 because they're sort of elective. We can do it if we have time. I know it's, I do want to get the COVID piece in and try to end by 9 o'clock. So maybe I'll turn it over to Carrie to do the incident command updates, and then Peter and Christine on the case counts and any civic or recreational pieces.
Great, thank you.
Thank you.
Incident command was a busy meeting. We started talking about testing capacity. And there are different ways, and I think there was a question about whether testing capacity, you know, is there a way to have a testing site here in Reading as we see cases going up. We didn't come to any conclusions on that, but we did agree that we wanted to pursue it. There was a question of does CVS offer it, but like there are some other ways. I've seen reports, you know, we talked about there are other ways of getting it. So that I think that'll probably be something that we'll want to, Peter will want to pursue and get Christine's feedback on, you know, whether what her assessment is of the need for that. We did start to talk a little bit about emergency dispensing sites because, you know, they don't just pop up. And while vaccine is not imminent, we need to start looking at the EDS plan and figuring out how to operationalize that. So that was agreed. And I think if I may just kind of riff a little bit, so the emergency dispensing site plan comes from a collaborative effort that is funded by the state. They provide regional support across the state. The state's divided in 7 regions. Reading's part of Region 3 and in a subgroup called Region 3B. Yeah, thank you. And there are planners that are tasked to work with each region to develop the plans. The plans are all they're variations on a theme, right? And the idea is that you want a similar plan. You want to know the state. You file these plans ultimately with the state. Yeah, and the value of it is knowing how a plan might be set up. What's the location? What's the plans for traffic and the like? So that if you need to bring in staff from other places, you can. And so that if you do, the plan is not all that different. You know, it's not going to look that different in Reading versus how it might happen down on the Cape or how it might happen out in the western part of the state. There's a fairly similar structure. So this dispensing site plan is a well-honed document, right? There have been a lot of people who looked at it from a higher level, and then there's work done locally to figure out how to populate it, make sure we have the local sites in, and so forth. So right now, that plan, Laura's done some work on it. That plan, I did a review of it because I've done work on a dispensing site plan development and assessment, and emergency management is also assessing it because they're our partners in standing up anything. So that's good news. We're starting to think about it, talk about how it might happen. We talked a little bit about how much vaccination would happen or could happen in the community. And if anybody's followed the news, the plan is so there'd be a first level of vaccination that would happen probably from the state, perhaps regionally, and that would go to healthcare workers. So maybe it's going to go straight to the hospitals. That's going to go to the healthcare workers, people who are directly exposed to COVID patients. Very quickly on their heels, that's then goes to first responders, EMS and public safety and fire and the like, and cascades down so that the general public they're in tier 3, and that is currently projected for maybe April, May-ish. So we've got some time, and because we're tier 3, there will be a lot of people who will have been vaccinated by other means in tiers 1 and 2. They may have been vaccinated because they're an employee of a hospital. They may have been vaccinated because they're an employee of a higher education institution. Lots of other ways. So it's not clear what the demand will be locally, but you still need to operationalize the plan. So I think we're in good shape to begin that. I think the great success, and hopefully you've all seen it, is the work on the Masked Up Reading campaign. Jane Wellman has been excellent, and a lot of collaboration from Command. And that's going to be widely distributed, and the intent is that that will stay live, as we say. There'll be variations on it. It might be for younger folks. It might be for grandparents. We've been tossing around some different phrasing that would appeal, catch people's eye and catch people's ear. So we really have a plan to keep that live and active for the coming months. There's a great recognition of how important it is. School department mentioned they're going to shift make sure their messaging was really on point about not just masking or face covering in schools, but all the time. They said maybe we're focusing too much on it in the building and we've got good compliance. We also can be part of the messaging of cover up all the time, not just in our buildings. So I think that's right. Those message board signs are up, broadly distributed throughout the community, thanks to DPW and to public safety. The DPW signs were put in place throughout the community. The signs on Haverhill Street right now, because of other projects and public safety, is able to kind of flip messages to make sure that the public safety message that needs to happen on Haverhill Street is there, but they're also incorporating that mask up Reading message and covering that part of the community for us. So that was good. There's going to be a banner on Town Hall. There's going to be a banner on the library. There's going to be some yard signs, similar to some other efforts that have been done, like the high school seniors and other things that happened available on public property. So it's been nice to see the engagement, and people are really moving forward on that. The superintendent gave us an update on school winter sports. They're really kind of assessing right now. They're not quite clear on what was happening. There was some revisions to the guidance, so then they had to run the MIAA. So they're waiting, but they're aware. And we talked again about the food distributions, because there is a very busy food distribution site at the high school twice a week that planning was able to go down and provide some assistance to the school department, who had taken on just a huge task. And it was nice to get to go and see the site and realize how much work they were doing and how much people really need the support. So that is a success. They're going to continue to work with them. That's public safety and fire, and I got to go and see some of the kitchen facilities. I actually got to meet Jean in real life for the first time. That was kind of fun. So that food distribution effort will continue, and that is a priority for command, because it's under one of our goals. It's about aid and assistance to residents in need. So we can continue to be talking about that, identifying this good communication flow of, are there other folks? How's the food pantry? How is the senior outreach? Things like that. It's all well covered. And we talked a little bit about the fact that there is a downtown shop the block campaign, that they have modified their actions. They're not encouraging people to gather, but they are trying to promote the activity, promote shopping local and promote folks coming and doing business safely, with proper face coverings and hand sanitizing and occupancy limits and the like. So we, talked about what their plans were, recognized it didn't need to be reviewed, and wish them success. And are grateful that they are following the guidance so well, and trying to keep everybody safe. And I think the only other thing is we got to talk about the site map. So when you look for testing sites, what has happened is everybody's defaulting to a MEMA generated map, which is in GIS, and it's multiple layers, and we pulled it up and looked at it. It's tricky to work with, and it came up because a few different people have been approached about having a hard time, others having a hard time finding testing locations, and looked at this map. It's not it's not as user friendly as it could be. So I actually put it forward on the local public health question and answer session, and I was told they're going to kind of forward it and see, because it does seem to be the default resource, and if people are having a hard time using it and then perhaps giving up and not going to get tested, that's not what we want. So. And I know I had mentioned it to the town manager, and he agreed. I think he raised it on the call that he participates in weekly. So I'm trying to make sure that there are ways for people to get the information that they need so that they can go get tested. And then I guess not command, but the last thing that Bob alluded to was, yes, guidance changed, I think yesterday. The governor announced something about changes in quarantine, so that you can actually, in very limited circumstances, test out of quarantine after 10 days. and puts a little bit more work on the health departments. So it was new news. I guess they're trying to make it easier for some people to move up out in their lives if they have met the standards. So busy times. 67 new cases. This 67 active cases right now.
Right. I mean, it's sort of exponential the way it's going up week over week.
Exactly.
You know,
And
it's
we're
scary.
back in that same R naught factor that we were in the spring of, multiple, every sick person infects 2 people. You know.
Harry, or does anyone else know about the new test that the schools are going to be having access to? I heard that, it's from the state. I just don't know that much about it, and I didn't know if anyone else on the board had heard about it.
I had heard about it, but I don't know anything more.
But what I heard was that they were going to, there's a new test by Abbott that is, the results are available in 15 minutes. It's using, I think, and the state was going to pilot it in about 134 school districts, not including Reading. And I'm not sure how they pick those, whether those are high-risk communities or what. And it would be used for staff or students who had become symptomatic, and they could be tested right there in school. The test is apparently much more accurate in symptomatic patients, not so much in patients who may have just acquired and are carriers as well. And I'm not sure where they're going to take this, but Carrie, do you have any?
Yeah, this did come up in command, and the superintendent did speak with us about it. So, and what you said, Rick, so yes, only available for symptomatic people. And one of the requirements of the pilot is that you use the Binax test. That's the name of the brand name. But then you also have to have a molecular test. It's not a sufficient standard, and that there was some question about the challenges of that. There's some questions about needing additional space. So it was something that was posing a lot of challenges for the school department. Everyone was invited to assess the likelihood of participating in this. And I think the challenges made it such that the benefits did not outweigh the challenges for our population. Because of that requirement, you still have to do the PCR test.
PCR, yeah.
Yeah.
I mean, I presume the effort is to try to catch early, pupils or staff who are symptomatic and ensure that they get a test and then, they're appropriately managed.
Right. But then the challenge is that, how are you are folks, it's almost like folks who are symptomatic are being encouraged, are being invited to come into the building so that they can be tested, which is a little
not so
confusing.
Counterintuitive.
Yeah. So yeah, I heard there were 130-ish. I'm not sure how long this pilot is. I know there was it's a multi-phase. So perhaps in phase 2 it will be I think they're trying to demonstrate efficacy.
Yeah.
And if they can get some good results there, then perhaps pilot phase 2 will be a little bit different, and they'll have learned some things, and Reading will might be interested in participating. But, yeah.
So I don't know, Peter or Christine, do you want to talk about case counts and permits and so forth?
Well, Christine should be talking about that, so I'm going to turn it over immediately to her, and if I have to add something in as we're going along, I shall.
Okay. Christine?
Sure. Okay. So right now, Reading is in the yellow. I have a total case count of 475 plus 10 cases from today. So that's 485. Case count over the last 14 days is 78. and our average daily incident rate per 100,000 over the last 14 days is 20.1. Our percent positivity rate over the last 14 days is 2.65%, and total tests performed from start to current date is 20,297. The test performed over the last 14 days is a little over 3,172, and the total positive over the last 14 days is about 84. Tests performed over the last 14 days would equal 3,172. Currently active, and this is according to Maven, is 51. Recovered 372. I know that there's some discrepancies on deaths reported. I have 38 total count to date, with one being revoked. And I can go into that in detail if needed. Transferred cases, meaning out-of-state transfers, 4. And if you want me to go into more specifics, such as demographics, I can do that.
Pretty sure Kevin started the ball rolling on that. It was a reasonable request, but everybody would be nodding their heads now. And I know we talked about it, Christine. These raw numbers, they just, send you in a circle as far as I'm concerned. But if you could add some the demographics, but the distributions and ages and
Yep.
and so forth. Go ahead.
Okay, so and I'm going from November 1st to current date. So this is just from the beginning of the month, and I can start keeping track of this. So there's multiple households right now that are linked to several cases that are in the school system. Any school-aged child in the public health school system, I work in collaboration with Mary Juliana and Sharon Grotto. So right now we have from ages 0 to 2, 1 case. Ages 2 to 5, no cases. Ages 10 to 18, 8 cases. Ages 18 to 45, 30 cases. Ages 45 to 65, 6 cases, and ages 65 plus, 6 cases. In the non-public school system, such as Austin Prep, there has been a total to date 18 cases, none of which were Reading residents, and several of these cases were related to sporting events. As far as clusters go, there's at the current time none to speak of. There were several, I would say late October, beginning of November. Contact tracing was done immediately, and as the protocol has changed with the updated guidance that just came out this week, and with a lot of people traveling for the holidays, I've reached out to my contact, Sandra Aronson, with the CTC, and a lot of the updated guidance will be reflected. My concern is some lab reporting, the electronic lab reporting with the state, and sometimes it's delayed. So transferred cases, closed out cases can sometimes take up to 2 weeks to reflect Reading's current data. I feel right now, when we compare our data with neighboring towns, such as Stoneham, Wakefield, who are also in the yellow, we're comparable. North Reading, I believe, is in the green still. And Chelsea, Revere, Lynn, Everett, they're in the red. Just trying to think if there's anything else. Again, the new updated guidance, the asymptomatic cases, they can come out of isolation on day 8 with a negative PCR. My concern with that, and as of several other public health nurses that I've collaborated with, is that many times in an asymptomatic individual, it's very difficult to get PCR testing covered by insurance. So we're sort of working on that as a group to see if, mobile testing or test sites can provide that with the new updated guidance. So I'll have more to report on by the time the next meeting.
That's great.
Yeah, Christine.
Thank you,
and
Christine.
Welcome.
I would just add to this a few things. Firstly, if you're looking at these graphs, you have a chance to let them digest, and you can see the age groups in bars or different colored lines. But the data takes takes on a life of its own when it's broken down. And Christine does a really great job of pulling that part together and giving us the sort of the inside look at the raw data that we've been receiving. And we have this is kind of delicate. I'll be careful how I proceed here, but it's important to know that this information does come in at different times, depending on workloads and so forth. And I'd like to address specifically a former member of the board who is great. She's on top of all this. She's a biostatistician of some sort, and I've had a pretty good relationship back and forth with just a couple emails. I thought maybe she would poke in tonight, and maybe we will hear from her. But she just brings to our attention, there's no controversy over it, about the fact that when we do get a watershed event, in other words, when the data comes in and it looks like all of a sudden we have all these new cases, or the death count increases, people will misunderstand it. So it's nice to be able to get this living piece of it that Christine provides, and not just the dots whenever something arises, and people can just kind of linger over those. And I think that's all I'm going to say. I stopped babbling forward on this because things about statistics and how on numbers in general. I'll tell you anything you want. Just squeeze them hard enough to tell you anything you want. But I don't want to bring this down to that level.
No, absolutely.
So can I just ask Christine, in the last 2 weeks with this increase, from your contact tracing, you haven't noticed that there have been any clusters as it relates to any of those events that we approved in October, and you're not seeing any even household clusters as a cause for the increased numbers. Any thoughts on that?
So yes, we have seen household contacts increase. And again, there are several students in the public school system that are connected with those household contacts. There was several cases end of October that were related to sporting events, in particular girls hockey. And so the contact tracing with the hockey actually was quite difficult because the coach and the owner did not want to forward the roster of the players. So we actually had to get the CTC involved to ask them to forward that information. So it was a little difficult at first to begin contact tracing, but again, thankfully, I feel that Reading has a very good relationship with the CTC that has been assigned to Reading by the Department of Public Health, and I have decided that, we decided that we are going to continue to meet weekly. Other communities meet with their designated contact person with the CTC maybe monthly, but I feel at this point it's important that her and I keep a weekly meeting just so that we can stay on top of it. It's same with the travelers report. It's very helpful, especially with the holidays coming up. I know that there are a lot of people traveling. I know many people don't always register with the Massachusetts Travel Report, but there, I would have to say that Sandra Aronson and the CT, they're on point with their information, and it's just good to have that open relationship with her, and that I can communicate with her even if we don't have the scheduled meeting. She's pretty much made herself available when needed.
Okay, thank you.
That's great to hear, because I know that the CTC was a concern for folks early on, and would it work? How does it work? I'm really glad to hear, Christine, that is working well for you, and it's a good resource for you.
Okay, thank you.
Christine, can I ask you a quick question? This is Kevin.
Sure.
So you had the 18 to 45 age block, obviously, is the biggest number with 30.
Yes.
Do you have that? And if you don't have it readily available, it's fine. But I was just curious if you have. Well, two-part question. One, do you have where that's coming from? And it doesn't have to be specific. It could just be industry standard, gym, restaurant, what have you, or other. And then also, do you feel like this adult group is the ones that is giving it to the 10 to 18-year-olds? Or do you think or is it going vice versa?
It could be vice versa, and you're right about that. So that is where the multiple household cases are linked to school-age children.
Okay. And I think you answered that it is coming from restaurants and gyms and venues where people are gathering, correct?
Correct.
For the majority of it. Okay. Thank you very much. Thank you for all this work you do. I know you've had a huge workload thrust on you over the last few weeks with contact tracing. So thank you very much for this.
Welcome. Thank you.
I never try to miss an opportunity to make some kind of a point. And I was shaken earlier when Bob was talking about a previous nurse who couldn't fill 10 hours worth of work during the downtime. That's ridiculous. If you have somebody that's dedicated and there's plenty of things. I mean, this lady here, Christine, is meeting once a week instead of some other communities that only want to meet once a month. If you're motivated in public health and you have the good fortune, I think, of carrying a nurse's license, you can never stop.
So much work.
There's just so much. You find something you're interested in and go for it. Otherwise, do something else. So I'm disappointed to hear that, and I would never have any problems filling nurses' hours if we had nurses' hours to fill. That's all I got for now on that point.
Thank you for saying yes. Thank you for saying that. I think that's a really important point.
And Christine is an excellent example of someone who's dedicated to public health. Now, I don't know if she's going to last forever, but I've worked with a lot of good nurses over the years that just can't find enough hours in the day to keep your profession alive.
Peter, can I ask you, in terms of civic and recreational permits, we don't have to go into any detail, but were there any questions or any issues there?
I know you wanted to end 8 minutes ago, so let me just take 3 more minutes to make 3 points. We're working with permit sharing is now gone public. And that's the software that we use to track all the permits in town. And now whenever anybody comes, this just happened in the last couple of weeks, whenever anybody comes in to grab a permit to do one of these civic events, they have to have the addendum for the Board of Health. That's all been placed online on this permit sharing software, and now it comes through here and we can track it. Even did some testing this past week and it worked out really well. The only permit addendum that we've approved since the last time we met was for this candlelight vigil that's coming up tomorrow night. Yep. And, again, I guess this falls under the heading of I never like to let an opportunity go by without, kicking the tires of some sort. But this lady Ellen Richards is a student at Reading High School, and boy, was I ever impressed with her. And besides, organizing this candlelight vigil for young folks that have passed away, she was altogether intrigued with sharing some of her time with Mask Up Reading that we're pushing forward. So in other words, tomorrow night there'll be, I don't know how many people are going to show up. I hope a lot do, right at the Common outside Town Hall. But it's really an opportunity to market what we're talking about in this circle. And so she was all together there. And there's opportunities out there. One more pitch for young folks. We only get them for a couple of years and then they go to college. But I mean, the value of youth and helping affect change is just incredible. And I don't think we ever take advantage of that enough. The third point I would say is that with this process of us using the addendum to prove it has now included an interview by me. Anybody who wants this, I call and talk to. I want to get a feel for them and make sure that they know exactly what we're talking about. Get into some specifics. What are you going to use for hand sanitizer? What are you going to, how much of this stuff do you know? That's how I got to meet this lady, Ellen, and carried on with her. But even the other folks in the past few weeks that I've been here, everybody's open to have a constructive conversation with somebody from the health division. And, that's really great. So all the paperwork, who cares? Let's just talk about it and see if they feel like they're going to comply. And so then I record that too. And those are the three pieces I have. And that's not specific. It really wasn't a busy last 2 weeks, but just pass that along to you folks so you know what's going on there. This is an important part of our program, I think. Really good.
Yes. Very. Thank you for that work, Peter. I'm really glad to hear the way you're approaching these things. That's important.
Yeah. I mean, it seems like there was a lot of these coming through in the summer with all these activities, but it's quieting down as we get into the holiday season.
Yep.
So, so just in terms of our next meeting, some of the things that I have is we may revisit the public comment and the health director report. We actually are due for a health director report because it's the first Thursday meeting. We're going to hear back on the budget proposal. And I think those are the main things, unless there's something else we should have on the agenda. So with that, Jean, you were going to say something?
I was just thinking about January being a planner, sorry. And wondering if, and it's obviously you can't decide now, but just if there's, I know we've talked about maybe going to once a month for the board to meet, but I know plenty of time to talk about that.
Yeah. I think I would love to go to once a month, but I kind of feel right now with the vaccine around the corner, the ongoing COVID escalation, we kind of have to grind through twice a month for a little bit longer. We'll see.
Agreed.
Great. I support that.
Yeah, I agree.
Can I have a motion to adjourn?
Motion to adjourn.
Okay.
Well,
Second. Roll
Thank you.
call. Carrie.
Carrie, yes.
Paula.
Yes.
Yes. Rick, yes.
See you,
Bye,
everybody.
everybody.
Happy
Good
Thanksgiving,
night.
everyone.
Happy Thanksgiving.
Yeah.
Stay safe.
Thanks.
Happy
folks.
Thanksgiving.
Yes. Thank you.